My name is John Pachuntik. I'm one of the partners and dentists at Luma Dentistry. I've been practicing dentistry for 14 years. You know, at Luma Dentistry, we're really excited about embracing digital dentistry. Digital dentistry can mean a lot of things, but for us in dentistry, it's been taking a lot of traditional processes and using the digital revolution that's been happening in all industries in our industry. So it allows us to, instead of having traditional models where people gag on impressions, we can take those by doing a scan. At Luma Dentistry, we use the Trio scanner. This is one of the scanners we've been really excited about. We've used many scanners in the past, but this scanner has kind of set the bar in digital dentistry. We were one of the first offices in the country to get the scanner. We even had to wait for it to pass customs. It did come through. It allows us to basically use a laser light to scan a patient's teeth to be able to produce a true color 3D model. Traditional model taking involved the process of taking an impression, and then we would take that impression, kind of mix some water and powder, put that together in order to make a model. Then a lab would scan that model to create a digital crown. By using the Trio scanner, we skip all those steps in the middle that can lead to a lot of inaccuracies and also speed it up. So if we're using a lab across the street or across the country, the lab can begin working on that crown within a matter of minutes. Because the Trio scanner uses a visible light to take the scans, really there's no discomfort during the procedure. There's no threat of any kind of using any kind of substance which someone might be allergic to. The creation of the models is basically done by a gentle wand that uses a visible light to create the 3D model. One of the other technologies we've invested in at Luma Dentistry is the 3D cone beam. The 3D cone beam allows us to take a 3D X-ray of someone's mouth. So traditional X-rays give you a 2D dimension of a person's tooth, which is great for finding decay. But with a 3D model, we can really kind of explore someone's anatomy. So it's like the difference between looking at a picture of an apple versus actually being able to hold an apple. Really, the new 3D X-rays has really allowed us to explore someone's mouth in a whole new way. So rather than just looking for decay, we can kind of map out where your nerve is. We can map out how much bone you have to determine how a surgery or how a tooth might need to be extracted and how we can come across it to have a much more smooth transition before we begin your procedures. The main benefit to our patients for us being able to have this 3D scans is really reducing the amount of time that the appointment will be. When the surgeon is able to go ahead and know what implant he's going to place and where he's going to put it, it's going to reduce the amount of time that you'll have to be sitting in the chair.